The doctor once told me that she would have to go back to med school if my symptoms were caused by my spine or my brain. And guess what? I needed brain surgery. And she made fun of me to another doctor that was in the room. And that was just the mid part of my journey. I had a Chiari type 1. It was already diagnosed. It was known about. It was written all over my chart. I had it for, at that time, 16 years. Lots of documentation on it. And I went in I started developing scoliosis. Go in, see this doctor. I'm at a world-renowned spine center, by the way. Like, this isn't like some random podunk hospital. I drove to Boston. Correction, my pregnant wife, who was 5 months pregnant at the time, drove me to Boston through traffic to get treatment. I go in there for a trigger point injection, which basically just like they use ultrasound, they found a spasm, they stab it with a needle. For me, they injected saline. Went home, kind of felt okay. Next day, going for a follow-up. The second we get out of my driveway, and again, I live in a quiet area, we get to like a more busier part, body starts freaking out. Everything is too much for me. I'm overstimulated, my back's killing me, I'm dizzy, I'm lightheaded, my heart feels like it's gonna explode, both my hands are numb, my ears are ringing, splitting headache. I had to put in earplugs I kept in my pocket, pull my hood over my head, put on sunglasses, and I barely made it in. We called halfway there and said, hey, this is starting to like really ramp up on him. It's not normal. What should we do? Should we go to the hospital? Should we come in to see you? And they just kind of like, wow, that's crazy. Yeah, come in to see us right away. So we continue. It's about 2 hours to get there. We get there and they bring me into the room and I'm thinking, okay, I'm going to finally maybe get an answer. Cause like, this is like, I just saw what happened to myself. Like, what is this? And the lady let me say symptoms, what happened for about maybe 30 seconds before she cut me off mid-word and said, none of this is coming from your spine. If it is, I need to go back to med school, as she scoffed and pointed to the doctor who was a student doctor in the room with us. And you could see the look on his face. He kind of was like awkwardly smiling. And then at the same time, like he wanted to ask follow-up questions, but he's interviewing for a position at the spine center. So fast forward throughout the appointment, she just keeps on brushing me off, keep telling me like, nothing has like anything to do with this. You're a psych patient. You need to go see a therapist. I needed brain surgery. I went, I saw more specialists, and I saw therapists, by the way, who at this point I'd seen a couple, and each time they were like, dude, this isn't anxiety. This is clearly physiological. Like, you should actually be a therapist yourself once you recover, because you're really good in like the way that you speak, and you're a very grounded individual. Like, awesome, that's great to hear, appreciate the compliment, but what is going on with me? And eventually, I bothered to take my temperature because I went to all these appointments saying I was cold and I was shivering and I was freezing. And lo and behold, I was hypothermic. My body temperature was around 93 to 94 degrees whenever I was having one of these flare-ups. And the doctors didn't so much as bother to take out a thermometer and see if I was telling the truth. They told me that was anxiety. So go in, find the right surgeon. He points me like out and says, hey dude, you're gonna need brain surgery. My wife at the time was 7 months pregnant, so we decided to wait. The second my son was born, the following morning, called him up and said, hey dude, my son was born yesterday. I need to get on your schedule. He's like, absolutely, take it easy, book you out. And then I have surgery, major surgery, horrific recovery, and which is to be expected. You know, they're literally sawing through your skull and then cauterizing part of your brain. Not really a fun time. So recovering from that, I got to miss basically the first, I don't know, maybe 4 months of my son being around because I can barely tolerate being in the room with someone, never mind a screaming infant. So thanks, doctors. I appreciate it. You guys are really not helpful even the slightest bit. And this, by the way, was going on for 3 years at this point. I kept going to see doctors. I kept seeing specialists. I went to physical therapy almost every day. I did everything I was supposed to. I said the things I needed to. I advocated for myself. Everything was diagnosed. I had imaging. They still did not care. They labeled me as a psych patient, and from that point on, that's all I was to them. Anything I said, I got laughed at and pushed off to the next doctor. So just making these videos to make sure that other people out there that are in my scenario, or any scenario, but particularly Chiari's, you need to advocate for yourself, and if you think it is at all related to your Chiari, you need to find the right specialist and don't waste your time with these bozos. All right, please like, subscribe. I'm going to keep making videos. I have a lot more to say.